I love the course, learned a lot from the course. As a pelvic floor therapist, we are taught usually to focus a lot on the pelvic floor. And so that's what I was doing with my clients, both male and female. And with this course, we really learn, we have to address, especially in men, the bladder issues. I think something that I never thought about before. So that really changed my perspective because I see now ways to better help men with these urinary issues instead of just focusing on the pelvic floor. So about the bladder issues, what I learned is that most men do suffer from bladder issues, and that we can address them by addressing spine, so the position of the spine. So shifting in posture, using repetitive movements to help either increase or decrease bladder sensations. And also we can use techniques of breathing to address the abdominal pressure. So how to shift the pressure, how to, with specific breathing exercise, how to increase pressure or reduce pressure to help with bladder filling or bladder voiding. And obviously also all the psychosocial components that you have to take into account in order to efficiently treat men with lower urinary tract symptoms. Most men post or post-postectomy as well. Usually I would focus a lot on pelvic floor. So in assessment and looking at how their pelvic floor function works. And so after this course, my approach is going to be more global. So to look at how the person functions in general. So not just looking at, okay, your pelvic floor, what is it doing and how is it reacting, but also how can I help your posture to help your recuperation of the bladder and of the pelvic floor during the post-prostatectomy and pre-prostatectomy as well. So there are some things that we can do instead of just giving pelvic floor exercise. We can give exercise to address posture problems or pressure regulation problems, which will help the recuperation after the surgery. So it's a much more comprehensive, and it's something that adds a difference between what the patient is going to get from other healthcare providers. So usually urologists and nurses will give leaflets of, oh, here, read this book and do Kegel exercise. But now, instead of reinforcing that, I can say, yes, okay, maybe not do the Kegel exercises before your surgery, but you can work on other things to manage before the surgery. So your posture, your breathing, and after the surgery to help give the right exercise at the right time. Exactly. So Kegel exercise can worsen some symptoms in some men. So make the pelvic floor too reactive, or so they will have more problems with voiding, for example. The lab and ultrasound is very interesting. I think ultrasound is a very powerful tool. Also, ultrasound very useful, I think, for the feedback situation with the patient. So you can evaluate, but you can also, with the tablet, you can give it to the patient and educate him and saying, okay, look at your contraction, look at what it's doing. When you're doing this, look at what it does to your urethra, look at what it does. And so that can help the patient understand the importance of the exercise and why he should be why we're giving it to him. So those are the two applications that I think is pertinent. Absolutely. So the live models are absolutely wonderful. Really great collaboration. Thank them really for being there, because they allow us to practice, especially as a woman who does not have the anatomy. It's very, very precious information that we can have to evaluate and palpate and everything, but also to exchange with them, to know how they feel, what does it feel like to them, so that we can better be more comfortable with our male patients when we see them.